Okay. Other questions besides that?
For my family doctor, his one question was, what happens to the rest of the stomach that's less than?
It's a really good question, and remember that we have had patients who've had revisions. Now, by revisions, and you saw Moira yesterday, right? You know she had a revision. So I went back and looked. So I can tell you unequivocally what happened to her old stomach that's been bypassed, because I was there. And the short answer is nothing. And that's good news because we don't take anything out, because we have this idea that we want what we call an exit strategy. We want a way out. So if you've ever been in a theater and you've seen those red exit signs, the idea of that is, God forbid that there's ever a fire in the theater, you have those exits there. The same thing's true with the mini-gastric bypass surgery. In contrast to some of the others, it can be undone. So let's suppose you've been through all this, you've read about it, you've learned about it, and it's your opinion, I hope, or I think this morning, that this is a good idea for you. Well, I don't know if you've had this experience, but I've had a lot of times when I thought something was a good idea, but once I got it home, that purple tie, not such a good idea. Well, it's nice to know, I think, that for any reason, let's suppose you got some terrible cancer or some kind of terrible illness, and they said, you know, you need all of your stomach back working to be able to fight this, God forbid, you maybe get AIDS. You know, you got AIDS and you need to, you know, AIDS patients wither away and get real skinny and malnourished. Well, you wouldn't want a gastric bypass in that situation. So it's nice to know if you wanted to, within about 30 minutes, we can undo everything, and all of the bypassed stomach and the bowel is standing by and ready to go back to work. So if any tragedy like that were to happen, you can have this undone in about 30 minutes surgically.
You promise to be working for the next 40 years, right?
Yeah. Well, even if I'm not, the neat thing about it is it's very easy to undo. Yeah, because we've actually had some patients of ours who've run into Roux-en-Y doctors who told some of our patients, you must have a Roux-en-Y, or we don't like your MGB and you have to have it undone. And it's very easy even for another surgeon to